I'm here today with Dr. Leslie Dodson from Big Sandy Healthcare. Welcome, Leslie.
Hi, thanks for having me.
And you actually practice out of the Martin County Community Health Center in
Yes.
Inez.
Yes, I do. I'm a family physician there.
Great. And you're here today to talk about prediabetes and why it's so important to be educated on this subject.
Yes, that's correct. So very often I see patients in my clinic and I detect a high blood sugar level. I'll ask the patient, are you aware of this? And they tell me yes, they are, but they're under the impression that it's not a big deal. But I want people to know it is a big deal.
And so what is prediabetes?
Prediabetes is when the blood sugar levels in the body are higher than normal, but they're not yet high enough to be full-blown type 2 diabetes. It's important to know at the point that it's prediabetes so that you can make changes to prevent your progression on to full-blown type 2 diabetes. You see, the damage to the body that comes with diabetes is already starting when your sugar is in the prediabetes level.
And who is at risk for prediabetes and what causes it?
So people who are at risk for prediabetes are those who are overweight or inactive, or if you have a family history. We don't know the exact cause of prediabetes, but we do know what goes wrong in the body. The body's blood sugar levels raise when we eat. Your body normally should put out insulin to help burn that sugar off as energy. In prediabetes and diabetes, the body can't use its own natural insulin the right way, and so the blood sugar levels remain high. And this can lead to organ damage and complications such as kidney damage, blindness, and amputations.
Wow. And how would someone know if they should be screened for prediabetes or if they're at risk?
Well, certainly the risk factors that I mentioned, you would want to see your doctor for a full evaluation, but oftentimes prediabetes doesn't have any symptoms. So I do recommend that everyone see their doctor at least annually for a complete checkup.
And if someone is diagnosed with prediabetes, what can they do to stave off type 2 diabetes or to stay healthy?
That's a great question. So the first thing I would ask a patient to do is to make lifestyle changes, and that would start with weight loss. I ask patients to lose about 10 to 20% of their body weight. So if you weigh 200 pounds, I want you to target losing about 10 to 20 pounds. I would ask that you avoid bad carbs, so sugary drinks like pop, juice, energy drinks, sugary Kool-Aid. I would want you to eliminate those, and also try to stay away from unhealthy carbs like white bread and potatoes. Instead of choosing biscuits or cornbread, I'd want you to choose wheat bread. I'd also like you to start an exercise program. Walking as little as 20 minutes a day can make a big difference in terms of how your body is able to use its own natural insulin and maintain a healthy blood sugar level.
So basically, maintaining a healthy weight, being active, not eating a whole lot of, potatoes, white bread, cornbread that everyone in this area loves.
Yes.
Be mindful of those things.
Yes, just be aware, things in moderation, and see your doctor so that they can help guide you to make healthier choices.
And of course, there are plenty of doctors at Big Sandy Healthcare all around the region. Just mention quickly where some of the clinics are, some of these locations.
Yes, we have a very competent, friendly team of doctors, nurse practitioners, and PAs at our 5 clinic locations. We have a clinic located in Pike County, the Shelby Valley Clinic. We also have a clinic at Grethel, the Eula Hall Health Center, formerly the Mud Creek Clinic. We have a clinic in Magoffin County, the Hope Family Medical Center located in Salyersville. In Auxshire and Floyd County, we have Physicians for Women and Families. And then we have my home clinic in Inez, the Martin County Community Health Center. And at each of these clinics, we offer full spectrum care, everything from in-house laboratory, in-house pharmacy. At 4 of the 5 clinics, we offer dentistry services at many of our clinics, and 3 of our clinics have in-house x-ray.
Wow. Well, thank you so much, Dr. Dodson, for joining us, and great information, important information for the public out there.
Thank you for having me.